My name is Ricardo Rodrigues, and I am the head of the Health and Care Unit at the European Center for Social Welfare Policy and Research, a research center that is based in Vienna, Austria. The European Center carries out comparative research across Europe in a number of areas of social policy. By comparative, we mean research that aims to understand common trends, but also the similarities across different countries. Research that also aims to increase the scope for mutual learning across different countries. And we focus on a number of social policy areas ranging from pensions, labor market, to long-term care and health. And as I said, our geographical scope is Europe, not just the European Union, but also countries that are not members of the European Union. Austria has a fairly developed health and long-term care systems with relatively generous levels of public expenditure, but these two systems are for the most part organized and governed quite separately. We find this in other European countries as well, but I would say that this is particularly visible in the Austrian context. And this, of course, has a number of potential implications. First of all, for users and their carers, it could preclude them from accessing the services and benefits that they need, but it also has potential implications at the system level, because it could lead to an inefficient allocation of services across the health and long-term care divide, and there seems to be quite some evidence that this is happening. So I would say that this is definitely one key policy area in Austria right now. Another area that should deserve priority, in my opinion, is that of inequalities in the use of different types of care. Austria is characterized as a country that is a familiaristic country, so one where the family is the main provider of care to dependent older people, and where public policies are organized in such a way as to support families in this role of care providers. And there is quite a body of evidence that this type of approach has led to gender and socioeconomic inequalities in the Austrian context. And this is an aspect that has not yet perhaps merited the attention and also the policy intervention that it should be getting, in my opinion. Finally, another area of relevance in the Austrian context, I would say, is a recent development that took place just last year, where the asset contribution for residential care has been abolished, and this is a development that I think could have quite a number of implications also for other European countries. So in Austria, we used to have, when accessing residential care, the out-of-pocket payments used to be calculated also bearing into consideration the assets that people had. And this asset contribution was recently abolished, and it will be quite interesting in the Austrian context to see, on the one hand, what will be the effect of this measure in the demand for residential care, whether this will lead to a higher demand for residential care services because they have become, in effect, less expensive for users and their families. But it will also be quite interesting to see, and this is research we're currently carrying out, to see what will be the potential distributional effects of this measure. So who will stand to win and to lose from the abolishment of this asset contribution, which is a feature that is present also in many other European long-term care systems. So I think that's why the consequences of this policy measure might be of relevance for other European countries as well. One important change that has occurred in the past 5 years in the Austrian long-term care context, I would say, is the greater recognition, the greater support that has been attributed to informal carers, particularly informal carers of working age. As I said, the Austrian system is very much based on the family, very much based on the idea that the family is the main provider of care, and public policy should support this role. But then in the last 5 years, we've witnessed in Austria the establishment of a number of care leave schemes that have, I would say, improved the possibility to conciliate informal care provision with paid work. We have now, for example, the opportunity to provide informal care and to combine this with part-time employment. We have also, in the last 5 years, started to pay notional contributions into the pension insurance scheme for those people who are providing informal care to older relatives. So this has been an interesting shift, in my opinion, from a policy stance where the family was implicitly seen as the main provider of care, to one where there is a greater recognition of this role, but also a greater recognition of the potential difficulties in conciliating this caring role with paid work. And these developments are likely to have an important impact, particularly among women of working age, which form the overwhelming majority of informal carers in Austria presently. I think one area that we're still lacking in Austria is that of quality management and quality benchmarking in the field of long-term care. Quality is very much a responsibility of the several several federal regions in Austria, which means that there is quite a wide variety of regulations on the one hand, but it also means that there would be quite some potential for us to learn from the experience of different regions in terms of the regulation of quality in long-term care. The problem right now is that very little of this information on quality is made public. And this really hampers the ability of users and their families to make informed choices on the one hand, but it also hampers the possibility for providers, but also regulators, to compare with one another across different regions, across different organizations and providers. So making this information on quality accessible and public, I think could have quite a positive impact, not only in potentially driving people's choices, but also as providing a good basis for the comparison, for the benchmarking of different providers across Austria. As mentioned before, there is a lack of integration between the health and the long-term care systems in Austria. And I think presently we don't have yet a good evidence based on the possible consequences of this lack of integration between the two systems. For example, we don't know how this lack of integration may be impacting some outcomes or the performance, for example, in the healthcare system. We don't know whether, for example, we have delayed discharges from hospitals or avoidable hospital use due to differences across regions in the availability, but also access to long-term care services. And I think this could be one piece of research that would be of relevance because it would highlight potential geographic inequalities between Austrian regions in access to health and long-term care for older people, and it could also provide could provide policymakers with quite important information about how to improve the performance of both systems. So I think this would be quite a worthwhile piece of research to carry out in Austria. I would say that's pretty high. I would probably give it a 7 or 8. Long-term care has been very much a topic of discussion, both in the public arena but also among policymakers. So I would say this is quite high in Austria presently. I think we need to differentiate between the universal cash benefit, the Pflegegeld, uh, for which I think there is a very high level of awareness among the Austrian population that this benefit is available and how it works. Uh, so I would say we need to distinguish that between that and probably a number of services that are targeting older people, but also their carers, where probably the awareness is much lower, where probably there's quite a number of doubts uh, between the services that are available through the healthcare system and through the long-term care system. So overall, I would probably give it a 6. I'll answer that in relation to the wider picture in Europe, and I would say that in relative terms, when compared to other European countries, the Austrian system provides a fairly good amount of support to people in need. I would say I would place this between 6 and 7. But this is also a reflection of the relatively low average support for older people in need of care that we find across Europe, I'm afraid. The support for informal carers has definitely improved in the last years, but I would say that this is perhaps still lagging behind in comparison to other areas of the Austrian long-term care system. So I would probably give it a 6. I would say this is definitely one area where I would give it a lower grade, something between 3 and 4. There is quite some scope for improvement in terms of the integration of health and long-term care systems in Austria presently.